Hi, thank you for watching Digging to China. I'm Dong Xiong. Omicron variant has hit China hard, drove the worst outbreak in China since Wuhan in early 2020. Throughout the pandemic, China has adhered to a strict zero COVID policy. It aims to stamp out all outbreaks and the chains of transmission using a combination of border controls, mass testing, quarantine procedures, and the lockdowns. Two major Chinese cities, northeastern industrial hub Changchun and the southern economic hub Shenzhen, are under lockdown. More than 26 million residents are forbidden from leaving their homes. Shenzhen, which borders Hong Kong, suspended all business except for those deemed essential from March 14th to March 20. Public transportation has also been suspended as well as indoor dining. All public venues have been closed, excluding grocery stores and pharmacies. Shenzhen will conduct 3 rounds of mass PCR testing for all residents during the lockdown. Residents have been advised to avoid leaving the city unless necessary, and those who need to travel must present a negative PCR result issued within 24 hours of their departure. Major Apple supplier Foxconn announced it suspended its operation in Shenzhen to comply with COVID-19 restrictions in the city. Toyota halted production as well. Bloomberg Economics warned that the Shenzhen restrictions could inflict the biggest pandemic-related blow to China's growth since a nationwide lockdown in 2020. The restrictions imposed on Changchun is more stringent. Changchun has 9 million residents. Residents there have been banned from leaving their homes, while only 1 person per household is permitted to go grocery shopping every other day. Shanghai launched a 2+12 policy, mandating people in the same neighborhood, workplace, or school with close contacts of COVID cases to follow 2 days of home isolation and 12 days of health monitoring. The local government advised its 25 million residents not to leave the city unless necessary. Chinese officials have been under pressure to bring outbreaks under control and have been reprimanded by higher administration for poor performance as cases grow. China has dismissed at least 26 government officials this month in cities where outbreaks have occurred, including a mayor and a director of Municipal Health Commission in Jilin Province, and a vice mayor and a deputy director of the Provincial Police Department in Guangdong. Because of China's importance as a global manufacturing giant, the lockdowns are expected to create even more supply chain problems and product shortages. Just as much of the rest of the world is easing pandemic restrictions and eyeing a post-COVID economy. Any disruptions to Chinese exports that result in supply shortages could also drive international inflation higher. While the rest of the world is learning to live with COVID-19, but China is still doubling down on its zero COVID. A key aspect of the policy is border closures. Few people are allowed in or out of China, and those who do enter the country face up to 3 weeks of government-enforced quarantine. Some other countries locked the world out for over a year in a bid to lock out the pandemic. But in 2022, Beijing is treading alone. Australia, New Zealand, and Singapore were the once zero COVID countries. Now they begin slowly opening up again to the world. Inside China, some scientists and officials have also called for similar reopening to live a normal life in a world where it seems COVID will become endemic. Gao Fu, head of the Chinese Center for Disease Control and Prevention, suggested recently that the country could be ready when vaccination rates pass 85%, perhaps early in 2022. Others have joined the scientists abroad, warning China may not be able to keep highly transmissible new variants out, despite Beijing's autocratic powers and popular support for lockdowns and other control measures. But Beijing will most likely continue to enforce the zero-COVID policy, mainly because it is political. In the autumn, the Communist leadership will meet for their 20th Party Congress. It is expected to officially extend Xi Jinping's hold on power by another 5 years. Government and state media have seized on how the virus has spread in other countries as evidence of poor leadership and bad decision-making. Abandoning zero-COVID could potentially trigger a crisis in hospitals and healthcare that would open the Chinese government to similar criticism. The first few weeks of the pandemic, when hospitals in Wuhan were overwhelmed and the death toll included many medics, fueled fury and fear nationwide. The health risks of opening China up to COVID are likely to be higher than in countries that abandoned their zero-COVID policies. China has a high population density and a lower herd immunity in the population due to limited exposure to the virus and less effective vaccines. The health system is also relatively weak in much of the country and could easily be overwhelmed. And even if vaccines provide good protection against the severe cases, patients with less severe illness are more likely to be hospitalized in China. The country's hospitals are also manned by doctors who have little clinical experience of treating COVID, while professionals elsewhere now have 2 years painfully earned understanding of its development and how best to control it. Lynette Ong is Associate Professor of Political Science at the University of Toronto. She said, China's zero-COVID policy is driven primarily by social stability concerns. The regime sees COVID, SARS, and other epidemics or pandemics as a health crisis that has the potential to evolve into a social crisis. With that in mind, it is not hard to understand why they are willing to defend it at all costs. But the costs are high. As the rest of the world learn how to live with it, China will find itself alone, with few coping mechanisms. A key sign to watch for, though, is whether the approach to COVID shifts after the leadership decisions are made at the Communist Party Congress. But for now, authorities have clearly prioritized the political advantages of a COVID-free China and are willing to pay a very high price to keep that unusual status in a world where the disease is becoming endemic. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly. Until then, be well.